Hello, everyone. It is November 18th, and we are here for the webinar of the month. And today we are talking about the health insurance coin flip. And joining me for this topic is Parker Pennington. He's an expert in this field, and this is one of the topics that some of our clients have been asking about because health insurance is one of the largest expenses of any business. And it's a love-hate relationship that I have with healthcare insurance. So I wanted to have an expert on to talk about it. So how are you today, Parker?
I am doing well. And as we had mentioned earlier, just learning how to pivot with the best of them, whether it's technology or strategy or all of it during this crazy year. So appreciate you having me on and excited to hopefully share some little nuggets of knowledge that can help you guys take control of that fun thing that is medical insurance.
And that is one of the reasons we wanted to have you on, because like I said, some of the clients and the prospects that we talk to, health insurance is one of their largest expenses. So I had thought it would be a good idea just to have a webinar, just to debunk some things that are not so true, learn some things we may not know, and then be able to apply whatever we can to have some savings as well. So.
Exactly, because looking at it and just getting some knowledge in, if we don't have some actions that can take advantage of it, then, what are we doing? So that's the game plan.
Yep, good deal. So tell us a little bit about who is Parker Pennington?
That's a fun, deep question. We'll try and stay on the surface level of it today, but I'm a guy that I grew up, and I'm glad I get to talk a little bit into interior design, remodel, and construction space, because I actually grew up in Rockwall, Texas, OSB in garages and working on the residential side of construction, and never let me get near any of the tilt up walls or any of the commercial side of it just because I was a kid, but I definitely worked my fair share of interior finish outs. And so I was excited to get to talk on here, but I'm Dallas, Texas, born and raised, a fifth generation Texan. I came out of the industry, or came out of college with an economics degree, but went into the family business of sales and recruiting and having things that, deal a lot with people. And as you'd put in this description here, I recruited in commercial construction. I worked in the payroll and human capital management world for one of the big dogs, ADP, in that realm. And that may make some people happy. It may make some people hate me. So
that's another area, ADP and paychecks. That's another area, payroll and all that. A lot of our clients and prospects talk about.
Well, and I'll tell you, we'll leave it at the end of it. But if people want to reach out on there, that's been a specific niche that I've helped out with. Is one of the other fun industries that has a lot of mystery behind the curtain. So that those tie in well. And what ended up happening is I was one of 10 reps out of about 200 in Dallas for ADP selling benefits. And lo and behold, I walked into a company called GDP. And we started talking, and I was trying to sell them. And it was one of the hardest meetings I'd had. And lo and behold, it was a job interview. And I started hearing more and more about what they were doing and how they were viewing the market. And that's in turn, what I'm going to kind of portray here is some information and just kind of a change and shift in paradigm that really shook me up. And then that happened a couple of years ago. And then, I've been working as hard as I can to help spread the good word of insurance doesn't have to be a bad guy or a bad word. And on the other side of it, the personal side of it, expanding out, my wife and I are expecting our first baby in February. So awesome. A lot of craziness going on in the back half of the year, of course.
So now you were working with ADP and you went into GDP to sell them, and they sold you.
Basically, they said, listen, Parker, we like the way you tell stories. We're not going to buy the payroll software. We do our own insurance, but we'd love it if you come tell our story. And like I said, we'll allude to it a little bit later, but some of the things that they've opened my eyes to are some of the things I'm going to share with you guys. That's not even just GDP centric. It's just insurance as a whole and changing the way that we've been tailored and trained to look at it, and really just opening up the ability to control those costs. Because like you said, it's one of the largest costs now as well, but it's not just that, it's also one of the hardest to budget for.
Yes.
Because it's its own little animal.
So true. Speaking of that, what does the interior design, remodeling, construction industry, what does the market look like right now?
Yeah, and that's kind of where we wanted to start, because I wanted to make sure we were focused in not just in the industry of insurance in general, but also just tailor-made to what we're talking about here. And one of the biggest things that can help somebody with insurance, with healthcare, really, I mean, with a lot of decisions is data. So we utilize big data. We hack or buy into and get access to large amounts of data so that we can actually pull things in benchmark industries, and being able to just show where you're lining up and where you're stacking can give you some kind of indicators of where you are and what direction you need to take it. Or it may show you that you're doing great. So that'll be a couple of these things we're talking on. And on a whole, the interior design remodeling market's about a $15 billion industry, over 100,000 plus organizations and businesses, an average usually around about 2% growth per year. Now in 2020, due to some of the way the markets were shifting, they were actually predicting, and this is pre-COVID, they were predicting a negative 7.8% growth. So they thought it was actually going to go the opposite direction this year. And it's one of those industries that, interestingly enough, has actually gone a different direction in 2020 and only had about 1.4% negative growth, whereas we've seen other markets, for instance, entertainment, oil and gas, some of those that have seen double-digit, decreases in the amount of growth that's happening. So that's just kind of a little tidbit I thought that I'd put on there, which is a good sign. But on the other side of that, when you look at growth being only about 2% in the industry, the average increase in cost, and this is if you don't have a bad year, if you have a great year in claims, the average increase is about 3.5%, 4%.
Okay.
And so what you're seeing is that there's only a couple of years that the market growth was actually greater than the increase in cost of healthcare, which can be a problem. Because if I know one of my overhead numbers is growing faster than I can expand my business or bring in new revenue, then of course that's going to mean a problem for future me to have to deal with.
Right. And that makes sense. And just to talk back about what you were saying about the anticipated growth, and it was a lot better than they thought. What I've been hearing from a lot of my clients, and what I see in the industry, is that one of the benefits that happened is that when the lockdown happened and everybody was at home, people were now looking at the home in a whole different light. And they were looking at the kitchen, they were looking at the bathroom and at their rooms and saying, I need to make some changes. And so that had a benefit on several designers. In certain areas, I've seen an uptick or just as is. There have been a few areas that have had dips, but for the most part, a lot of the designers that we work with have seen either everything as is or they've seen an uptick. So it has been an interesting year, to say the least.
Oh yeah, well, and that's the key word, is interesting. I'm sure I hear that at least 4 times a call nowadays. But you hit the nail on the head, and I can even just, I didn't even write this down to bring up, but that was, over the last 3 months, I've redone 2 bathrooms and done my nursery, and one, I've impressed my wife with how handy I could be. So I thought that was a good sign of it. But you're right, people are indoors, people are looking at it and they're going, man, I'm spending a lot of time here, and we may be spending a lot of time here for the future. Let's make sure it's comfortable and what we can do. And it's even seen Lowe's and Home Depot. They've actually been 2 groups that have seen a drastic increase in their market share and their, sales, because of that same reason, the combination of people remodeling and using professionals, as well as the guys like myself trying to do it themselves and then reaching a point and then calling the professionals and bringing it in.
Yeah. So talking about that, what are some of the medical trends that you're seeing within the design and remodel space?
Definitely. And so I mentioned it just a bit ago. There's been only 2 years where the cost increase of medical insurance averaged less than the market growth. And that's, once again, that's not just specific to y'all's industry. That is across the board. We've seen there's very few times that this animal that has become insurance does not increase larger than what the market share and the growth does. And so what we try to do is we try to find KPIs, just key performance indicators, to give us an idea of what we can see moving down the road. Because this whole shift is to change the idea of insurance from, I'm going to buy it 12 months at a time, deal with it once at a time, and let's deal with it with what happened, and change it into something more of an asset management of, let's talk about not just what happened over the last 12 months, but what's going to happen over the next, and where we need to attack and what we need to do. And the trend that's happening, in the interior remodeling, one of the biggest flags that I saw pop up was what we call a PEPY.
Okay.
And what that is that stands for per enrolled employee per year. And what that is looking at is that's looking at your total premium. So, if I have a total premium, I divide that by my number of enrolled employees in my medical insurance, and that'll give me a PEPY. And what is shown in this industry is that the average is right around about $10,000 to $11,000 per employee per year for total premium, not just what they're paying or the company. Does that make sense on how that's calculated?
Yes, that does. That does.
Yeah. It's almost like job costing. You want to know how much of insurance for each unit of employment you're having put in there, when similar to job costing on how you do a remodel. But the market average is only about 7,000 to 8,000, which means that in your industry, and there are specific things I think that can attribute to that, is there's a higher cost for insuring your employees than in others. And a lot of that has to do with trend, but it also has to do with there's a grouping of companies that outsource to 1099 and other areas that can impact that. So that's kind of the first sign, is that the industry is over the cost of what you're seeing as an average.
Okay. And so do you see that play better in the smaller to mid-size or in the bigger players?
Well, it's interesting you say that, because really what we're talking and what we're focusing in is it groups everybody together. The big dogs, the small guys, the medium markets. Now, of course, I took out, whenever I was going through the data, I took out the national players, the 1,000, the big companies. So we're talking, call it small to medium to mid-market in the size of these companies. And really, the size is the name of the game. With insurance, and you'll see in a second when we break it down a little, it's all about economies of scale and getting as many people as you can onto a plan, because really only about 6% of an employee population drives 90% of an insurance cost.
Wow. That's interesting.
Yeah. And there's a specific example we'll break down in a second that I think will help. But really, and so what you're seeing, the reaction to this is you're seeing a lot of movement towards the high deductible health plan, that HDHP. The $3,000, $4,000, $5,000, $6,000, even $7,000 deductible plans, which in essence is usually coupled with an HSA and says, all right, these are lower premiums. This will help alleviate some of the costs. And the whole idea is to make employees a smart consumer of healthcare. But in turn, all it's doing is moving that financial burden more onto the employee and making it to where now, if I break my leg, I'm not just paying $3,000 in some co-insurance. I'm paying almost $7,000, $8,000 to cover a deductible, and it's made a system where now it's almost to where I'm paying this much for an insurance that's not really going to give me much benefit.
Right.
And so that's the trend that we've seen headed, not just in this industry, but specifically due to the high PEPY costs. You're seeing a movement towards that.
And then talking about the premiums, what is the traditional medical premium?
And that's something that, interesting enough, I worked in this industry for 2 years with ADP before I realized how the actual premium was broken out. And it's interesting to think that, because a lot of people in my industry still don't fully understand how this works and how it's broken out and why it works the way it does. And in essence, in the very beginning, it was a great a very noble idea of what they were going to do. But of course, and we'll talk about this in the next slide, human greed took over, and it's kind of run its will over how the increases have happened.
Imagine that in America, greed? Really?
Yeah, no. And don't get me wrong. I'm a capitalist. I believe you should be able to make your money, but you got to have some sort of restraints on it, and not let people just run away. And I'll give you an example that'll allude to how ridiculous this industry is here in a couple seconds. But so what we're looking at and what we're talking about, we're setting the self-funded, the level funded, and all those fun acronyms that sound confusing and daunting. We're setting those aside. We're going to talk about the pure traditional insurance market for an individual or for a group. Okay. What we're talking about is you've got your premium. Let's just, for math's sake, we're going to call it $10,000. I know that would be lovely as listening to some of the small business owners go, how are you getting $10,000 as your total? But we're going to just use that for math.
Okay.
So let's say that you have $10,000 in your monthly premium. Well, there's call it about 10, 15%, we'll call it 10% of admin costs that goes into that. Okay. So you've got your ID cards, your online portals, the safety blanket your employees love to see, Blue Cross or Cigna or United Healthcare. I mean, insert carrier here. It all works the same. So then you have about 30% of pooled claims. And what this means and what people don't realize is they take, and once again, I may pick on a carrier, but you can insert any carrier in here. They will take a 30% of everybody's claims, those premiums dollars, excuse me, and they will pool you together with other companies in order to share that risk out. And what that means is that now you're being pooled with a company that maybe you're performing great. You've got healthy employees, nobody's getting sick, all that's doing well. Well, now you're going to be pooled with a company that is maybe a long distance truck driving company that smokes a pack a day and maybe has higher costs. And that's something you never see because it's out of sight and out of mind. Mm-hmm. And in turn, this is what insurance is for, that pooling of risk. But what we need to start asking is, hey, who are we being pooled with and how are we making sure that we're not the boat keeping this anchor afloat versus being able to attach ourselves with other like-minded groups and other healthy groups, thus bettering our performance.
Right.
And the big thing on this to remember is if there is a, let's call it end-stage renal claim, somebody has kidney failure, they have to go in and have an end-stage renal. That's close to a $450,000 claim.
Oh, wow.
Right. And that's a daunting number. And there's a whole other bag of cats I could go down talking healthcare costs. But, Christmas is coming up in about a month. So we want to make sure to wrap this up. But what happens is that happens. Blue Cross Blue Shield, Aetna, Cigna, they're not the ones that pay that claim. They have insurance to pay that for themselves. And in a sense, it means that now they have somebody to pay that claim for them, but they can turn around and bill you for that same dollar amount. So that's a whole nother gamut that happens there.
Wow.
Yeah. So those are the two. That's about 40% of your monthly premium. So where's that other 60%? Well, what that is that's small claims, flu shots, doctor's visits, prescription drugs, non tier 4 formulary drugs, things like that. And this is really that 60% is where the money is made by these carriers, because if you have, call it 40 employees enrolled in your plan and you're paying about $420,000 a year in annual premium, you are not going to drop close to $250,000 on just doctor's visits and prescription drugs and small claims.
Right.
And what happens is whatever money that's left over in that bucket goes right into the carrier's pocket, out of sight, out of mind. You never see it.
Oh, wow.
And that's where the coin flip comes in. You hit heads, you have a great claims year, everybody's healthy, we're all working out. But, guess what? You still get a 3-4% renewal, even though we probably just padded these carriers' pockets by 10, 15% of just pure profit. Or tails, we have a bad year. Everybody's getting sick. We had a couple cancer claims and everything. Well, guess what? Now these carrier companies gets to just forward all those charges to you to pay them next year. It's no longer taking risk and offloading them. You're just throwing that risk to future Parker. He can deal with that during renewal next year.
Wow. How does the ACA play in all that?
And I'll tell you, it's probably just now getting to the point that, of course, we're going to take our political hat and throw it to the side. All right. We're going to talk all this in just a pure, use my economics degree, economic standpoint, and health insurance side. So like it, love it, hate it, whatever it is, what happened with ACA is before 2009, 2008, there were some cost controls in place. Insurance companies would call a hospital and say, I'm not paying $3,000 for an MRI. I'll pay you $300 like everybody else, because they had some skin in the game because that was their profit margin they were working on, right?
Right.
Well, ACA said, we're going to find a way to rein these carrier companies in. And they said 85 cents of every premium you make must be spent on claims. And that means that now as a carrier, my profit margin is no longer a dollar amount. It's limited to a percentage. 15% is what my profit margin is. So would I rather have 15% of $1 million or $1 billion?
Right. Yep.
In essence, what happened is they don't care what the cost is. And I'll allude to a little of the election stuff just because I know there'll be questions on it, but they don't care what the cost is as long as you finance it through them. And the reason it was passed so quickly and went through so fast is carriers saw the money on the wall. They said, man, you're saying that now we don't have to worry about actually fighting these claims. We'll just be like a credit card company, finance it through us. We'll charge you next year.
Wow.
It'd be like if I walked into the grocery store and said, I'm going to buy this loaf of bread. And I went over to the cashier and said, how much is this loaf of bread? And they said, well, depends. Do you have Amex? Do you have Visa? Or do you have MasterCard? And I said, I have Visa. They said, okay, swipe the card. We'll tell you how much it costs in about a month and a half. Yeah, yet we still just keep running and doing those same designs because carriers and, for a fact of the matter, brokers make money year over year in the idea that companies and individuals are just going to focus on that 12-month number and not think about that chess game that the carriers are playing, those 5-year plans, those long-term ideas. And that's really where we've been stuck.
Wow. Wow. That's interesting. And then how has the coronavirus played into all of this?
The lovely coronavirus. So besides making us all tear our hair out and learn how to work all the fun different virtual chat rooms and WebEx presentations, but what it did is it put a freeze on claims. So we're not talking the emergency claims. We're not talking the 30% of those pooling claims, because if you had cancer, you're still getting treatment. If you had end-stage renal, you're still getting treatment. You know, if you needed an emergency stent put in, those things are still going to be covered. The change happened where that 60% was not being utilized for a good, 3-4 months? There were several months where I, as an individual, was not going to go into the hospital to a doctor to get my physical or to get that, elective surgery on my carpal tunnel that wouldn't bother me too much, but there was a halt in claims. And so in essence, groups that were not in a self-funded or level-funded roles, as we move those aside, they were paying full freight for a product they were not going to be able to use during those times. So basically means, hey, now 60% profit every month. I'm sitting pretty as a carrier, right? I mean, I've got 60%, and we'll call it 50. Just let's call it. There's some people still going in. You still got 50% of profit or profit margin in every month that you're building. That's a business model I can get behind.
Okay. Wow. That's interesting. So with all of this, what can we do about all of this?
And that's the crux of it all, because if I'm just sitting here and talking about it and yelling into the abyss, then nothing happens, and what's the point? So the big thing is to be knowledgeable, to understand how that machine works in the background. Ask your advisor, your broker, hey, what options are there outside of the traditional market? Once again, still using Blue Cross and Aetna and all those sides, but how can I put myself in a program and use tools and data that can protect me on the bad years, but still let me reap the benefit on the good years? And, even boiling it down to some free little, nuggets are things that both an individual can do and a small business owner can do. Even a large business owner can do. Anybody can use these. Things like Good RX, and they've started advertising recently, but I came across them when we, side story, I'll make sure it's quick so I don't get on a soapbox. So my dad had a heart attack the morning of my 16th birthday, and he's fine now. He's doing great. But for about 2 years after that, we were drastically overpaying for his hypertension medications and had no idea. We get on Good RX and we realize if we go, instead of going to XYZ pharmacy, we go down the block. Even without insurance, it ended up cutting the cost down to a third. And there's, it doesn't happen every time, but it's something you can look on there with or without insurance. They've got little keys that'll show you, hey, go to this pharmacy, this one over here. And once again, if you want to hear more about the pharmaceutical benefit manager industry, there's 2 things you can look up. There's a 60 Minutes video about PBMs, and there's a Wall Street Journal video. You can find them both, I believe, on YouTube or the 60 Minutes website. That'll just that'll turn you off of the pharmaceutical industry very quickly.
Wow. Are there any questions we should be asking when you say talk to your rep? Are there any specific questions we should be asking?
If you are on a high-cost drug, or you are have a chronic disease, a cystic fibrosis, something that is a high-cost pharmaceutical drug, one of the biggest misses is patient assistance programs. That is a place that you can go where you're like, Prescription Hope is a great one, where you can go and talk to them with or without insurance and show what you're paying for, what your drugs are, and they can directly negotiate with them. We had a group that had an individual with a illness that costs close to $400,000 a year in pharmaceutical costs. And the company, they didn't want to change that. They wanted to be healthy, but we needed to figure something out. And so now it is costing less than $100,000, and it's costing him absolutely nothing to get those drugs. So patient assistance programs, that's a great question to ask your advisors, ask your brokers, is if you have somebody that is struggling with those medication costs, whether it's with or without insurance, Prescription Hope, patient assistance programs, those are places you can go and get help. So
Okay.
what can we do about it is just like I said, once again, what can we do about, what questions can we ask? I mean, you got to view healthcare. Of course, I got to put the caveat in. If you're having a heart attack, if you are broke your leg and you're in an emergency, don't sit there and pull up and start shopping like you do other industries. But get your care. But I have to put that in place. But if I'm sitting there and I've got a sniffling nose, don't go to an emergency room. Go to your telemedicine, go to your urgent care. But think outside the box and realize that as the number one consuming industry, economy in the world, America should be able to consume healthcare better than anybody else. But we spend an average of 15 hours as Americans looking at cars, an average of 10 hours evaluating TVs. I'd probably say an average of 15 hours evaluating Xbox versus PlayStation now. And we spend on average 15 minutes for healthcare, whether that's prescriptions or services. Yet we spend 20% of our GDP on it. So we got to start asking the question, just because I get referred here, isn't there a better option? And I'll give you an example. I got referred to do some blood work, just, once again, no harm. They said, hey, go there. It's $50 copay. You're fine. I call our advocacy group and say, hey, where can I go that's going to cost, it's going to be most cost efficient that still has the same level of care? I went to a group, and lo and behold, I went to another place, same level of care, same tests. It cost about a third in claims dollars what the other one did. And it was simply where you are. I mean, the variance for an MRI machine in Dallas, Texas ranges from $125 to $2,500.
Oh, wow.
And a knee replacement ranges from $17,000 to over 70 grand.
Wow.
And what's crazy is usually the number one service, the number one care person is about right in the middle of that. Boston, the average birth and delivery ranges from $9,800 to 30 grand. And the number one place to have a baby in Boston costs $13,500.
Wow.
So be knowledgeable about that. Think outside the box, understand who you're being pooled and risked with. I mean, by doing these things, we have a program with some of our clients at DFW that have been doing this for over 5 years that now can have a $0 deductible 100% healthcare plan because they understand how to consume healthcare like we've just been discussing. So ask for data, push the carriers, push your brokers for data, especially now. Like we said, with COVID, it's an anomaly of a year. But you may still get a increase, and you may have a carrier tell you, oh, it's because of COVID, or oh, it's because of COVID's coming in, et cetera. Challenge them. Well, let me see some data. I want to see what our loss run ratio is. A lot of times in the small market, they may not give it to you. Individuals, you're going to be a little tougher to get information, but ask those questions and challenges, and it'll start your mind being curious and thinking, how can I better budget and face forward for this insurance cost instead of just reacting and facing the wrong way?
Okay. So tell us a little bit about your company and how do they contact you if they have any more questions? And
of course. So GDP Advisors, we're out of McKinney, Texas, but we operate all over. We've got clients in all 50 states. Really, we focus in the fun world of all things medical insurance, dental, vision, but we focus primarily in finding out-of-the-box strategies to help companies take control of their healthcare costs. And one of the things that I wanted to do and be able to offer to everybody listening here is if you want to hear a little more, you don't want to hear a sales pitch, but you want to hear more about just this idea of how we can consume healthcare and how we can, get control back of the industry is if you'll reach out to me and say, hey, Parker, this is my company, this is my address. I'm interested in what you said. I'll send you a copy of our co-founder and our chief strategic officer, Seth Denson's book. He wrote a book last year called The Cure, how a blueprint for solving American healthcare crisis. And basically it's what we're talking about in a lot more detail, but it's a very short read, but it'll give you some insight and some little nuggets that'll help you understand how we got to where we are and what we can do moving forward from here. And, we represent companies from 2 employees all the way up to we represent more Domino's pizzas than anybody in the nation. So we've got a wide range and scalability and if there's something I can do, even if it's not working with you, even if it's just Parker, play devil's advocate, look at this and what do you think? Feel free to reach out and I'll do my best to be able to help you out.
Okay. Awesome. We appreciate that. So I'm going to open it up for questions now, and we actually have a few here. What is the differentiating factor with what you offer compared to the others in the industry?
Yeah, I mean, I can give a quick 10-second elevator speech on that side, but what we basically did is we looked at everything we talked about, the way ACA was formed in 2009, 2010, and we said, how can we build economies of scale for our companies and our clients that are 50 employees, 40 employees, 300 employees? How can we give them the same power as an Amazon or as a Berkshire or as a JP Morgan Chase? And so we've got a proprietary program that has now over 500,000 employees and over 1.2 million belly buttons that allows us to pool risk with like-minded employers and give you the same ability to come to the bargaining table with 500,000 employees instead of 50. And so that's the real big differentiator, is that. And then we do not accept any percentages of premiums as our commission. The biggest misnomer and realization is that, if increase goes up that you're spending, I shouldn't get paid more. So we take that off the table, and really that separates a lot of what many brokers are doing in the industry.
Okay. This is a political question. Just came in.
I'll tread softly.
Tread lightly. So what are your thoughts on the new administration that comes in January and their effect on healthcare and all that's happening within the Supreme Court and the ACA?
The fun question of the hour. I've been getting this even on.
This actual question was asked early on, so I just
No, and it's a valid question, because here's the thing. There's been a few times, and I'll use an analogy to help explain it, but there's been the United States for the longest period has been what you'd be like an aircraft carrier. It's going to take a long time to turn and go a different direction, right? It's not going to be like a jet ski and just plant and turn. Now, there have been some moments when that has happened. For example, ACA. How do we get that? How did that switch so fast? How did that get implemented so quickly? And what that is that the healthcare companies saw how much money they could make, and over the last 10 years have seen an average increase in their stock prices of over 600%. So that were big dollar signs. They said, we can change this real quick. And this may be a long way around the barn, but I promise I'll get there. So now, looking at changes, whether the current administration fights and stays or the new administration comes in, like I said, we're going to leave the political talk to the side. Whichever way it goes, the number one lobby in the United States, larger than guns, tobacco, and alcohol, and there's one more I'm forgetting, all combined, is healthcare. So unless they see more dollar signs, which they don't, and some of this disbandment, some of this changing, there's not going to be an easy route for drastic change. Now, I say all that with the caveat that a lot of what we hear in the media and in meetings and all through that, the whole conversation and strife that's been happening is focused on the individual market, which holds up about 2 to maybe 3% of the overall insurance market. So I want that to sink in. 98% of the noise we hear, whether it's, like I said, in media, politicians, healthcare companies, whatever it is, right now around ACA is focused on that individual mandate, those individual markets, and that side of it, which accounts for about 2 to 3% of the overall insurance market. So I would say I'm not fearful of any drastic changes that would negatively impact the private industry or the group employer benefit world. There haven't been pre-existing conditions in the group employer world since way before ACA happened. Those have never even been on the table for group plans, even in the self-funded world. So there's not as much angst as you would think in our industry because of the power of the lobbyists, whether that's a good or a bad thing. It's going to make change difficult, but also the actual focus and where the market shares lay.
Okay.
I hope that answered your question. Like I said, it's a very complex one, but on the other side of it, it's a simple one. It's complex in the essence of what they might try to do in small changes and little ticks and tacks. But the simple fact of the matter is that there's too much momentum in this industry and this machine for it to just stop on a dime and change.
Okay. Another question we have in terms of with the numbers that you were showing for the trends, do you see enhancing next year once we have a vaccine?
If we're talking claims funding and amount of claims, which is I go to the doctor and it costs $400 for him to see me that the insurance pays, that would be what the claim would be, even though I only paid my $40 copay. So in claims, in essence, there's a couple different lines of thought. There's a fear that there would be a massive increase in claims of everybody going, all right, we're all going to go get our physical all at once now that it's opened up. But in essence, what's going to happen is there's going to be a slow trickle back of people going back to get routine procedures, starting to go in to get some of those electives. So you're going to see the claims begin to increase again. Now, the rate at which it's going to increase is also going to dictate COVID, if it spikes back up and we lock back down, a lot of those factors. But in essence, I see next year being a lot similar to what we saw in 2019 because of the trend that was the way we were headed in the beginning of the year. But I don't see it spiking like many are fearing. Is that the question you were asking?
Let me see. Yes, that's what they said they were asking. Okay.
Excellent.
And then I'm trying to, we have one more question being typed in right now. Do you have anything that you want to add while we're waiting on this last question?
Man, I just think it's realize the amount that we, and I say we because even my wife and I are going through our open enrollments, and it's even things that I'm calling and asking an advocacy center and talking through different avenues, especially because we're having a baby. So that's going to be a whole unnavigated. Yeah. Those are unnavigated waters there. So I would say just understand there is so much that you can do to empower yourself in the healthcare industry. An example of my dad, he got his second hip replacement. We call him the bionic man, but he's got a second hip replacement. And the difference in him going on a Wednesday instead of a Friday on the same week was about $10,000 to $15,000. And all that is us going, hey, you're a surgeon. If you're not cut, you're not getting paid. Which day do you not have a surgery? And maybe we could bundle all this up. And Dad, you're flexible for a couple of days, aren't you? Yes. Okay, great. So let's go Friday. And now that just dropped from 25 grand to 12. And so there's so much you could do from that all the way down to prescriptions, all the way down to realizing the same MRI machine read by two different doctors can cost $500 and $5,000. Right. We've got to be aware of these and we've got to consume it. You know, like I said, if bread went like the way bread did in that example, I don't think Ms. Baird's would be doing pretty well.
Yep. Then that last question they were asking, is that healthcare blue book that you were talking about, the quality versus cost conversion, is that what you were talking about, that if they email you, you would send that out, or is that something else?
That's something else. So the healthcare blue book is something you can get outside of myself. What that is that's a way that you can look at that cost to coverage ratio and try and find out. There's also, you can sign up. I don't know if it has a cost, so forgive me, but there's one called My Ideal Doctor. And it does the same thing, kind of like what we did with that Boston variance. The reason why we have those numbers is we put a program in place that found how those hospitals treated premature births, how they did cost of care, ratings, healthcare blue, all that stuff. And the guy that was that was number one was right in the middle of that variance. So that healthcare blue book is something you can look up. Once again, not sure if they have a cost on it. What I was referring to is a book by Seth Denson, our co-founder, called The Cure. And it's only, it's a 100-page book, 110 maybe, and real easy read. But that's more of what I was talking about in greater detail. How has this industry fallen apart? How can we control and how can we consume as an individual or as a group smarter? Okay,
good deal. I think that was all the questions we have. Wait, if there's anybody else that have any other questions, you can ask them right now. But while I'm waiting on that, I would like to say, Parker, I appreciate your time and all of the information, because like I said, this love-hate relationship that I have with health insurance, but it's vital because it's one of the larger expenses of a business. So this is information that we all need to know.
Definitely, and I appreciate it. Apologize for the technical difficulties, but thank you everybody for sticking around on it. You've got my contact information. If you reach out, just make sure to say, hey, I heard you on the monthly podcast. And like I said, send your address, company name. I'll send you a copy of this book. It's an easy read, and it'll do wonders to be able to help you take control of those costs that are slowly creeping up your profit and loss margin.
Awesome. So next month, we're going to have setting up your marketing plan for success in 2021. This is something that we usually do with our own clientele, but I've been asked by some prospects and from some other groups to help them set a plan for next year. And so we're going to open up the curtains and we're going to take you into what we do with our own clients and share a lot of value and information on how we work with our own clients to set a marketing plan for the year 2021. So this is going to be not just a webinar, but also a workshop. And we're going to give out a lot of information there for you to be prepared for next year, which will be a great year. I'm already speaking that into existence. So hope to see you. Hope to see you next month. We appreciate the time, and we hope to see you next month. And have a great Thanksgiving. All right. I'll talk to you later.
Thank you very much. Bye, guys.